If you are a state, tribal, or local air quality agency with a non-attainment designation, you may be required to report the air quality index for the first time. Or you may want to increase communication with the public about air quality issues. This presentation will help you do that. I'm Susan Stone, Lead Health Effects Expert for the Air Quality Index.
And I'm Phil Dickerson, Director of the AirNow Real-Time Air Quality Program. I'm going to give you a brief overview of what we're going to be talking about today. First off, Susan's going to cover the Air Quality Index and the reporting requirements that the AQI has. She's also going to talk about when the AQI is above 100, and then I'll give you a brief introduction to the AirNow Real-Time Data System. I'll also talk about air quality forecasting and how you might start a forecasting program in your area, as well as the EnviroFlash real-time notification system that serves the public. We'll also talk about important target audiences that your agency can try to reach, as well as go over some voluntary programs that you might be interested in knowing about.
The Air Quality Index is a tool for reporting daily air quality and associated health effects, if there are any. These are health effects associated with exposures of 24 hours or less. The Air Quality Index includes a normalized scale that ranges from 0 to 500. This allows you to translate ambient concentrations, which are typically in units such as parts per million or micrograms per cubic meter, into unitless values of the Air Quality Index. The Air Quality Index is designed to reflect a continuum of risk. That is, we know that there's not one ambient concentration below which everyone is safe and above which everyone is at risk. So the Air Quality Index reflects the fact that as air pollution levels increase, there is increasing risk. In the good category, there are no health advisories. In the moderate category, there are advisories for unusually sensitive individuals. Unhealthy for sensitive groups is the category at which we can identify groups that are likely going to be at greater risk. These groups include people with lung disease, people with heart disease, older adults, and children. In the higher categories, from unhealthy to very unhealthy and hazardous, there are two levels of advisories. One level for the general population and a more serious advisory for people in sensitive groups. The Air Quality Index contains sub-indices for 5 criteria pollutants. These include carbon monoxide, nitrogen dioxide, ozone, PM2.5, PM10, these are also known as particle pollution, and sulfur dioxide. The index is uniform across the United States. It's used by federal, state, tribal, and local air quality agencies, and it's available on the AirNow website, which we're going to be telling you more about. It's regulated in the Code of Federal Regulations in Part 58.5 and Appendix G of Part 58.5. The Air Quality Index is linked to the National Ambient Air Quality Standards. An AQI value of 100 is typically set at the concentration of the short-term standard, and an AQI value of 50 may be linked to the annual standard if there is one. There is not an annual standard for all of the criteria pollutants. There are pollutant-specific health effects and cautionary statements associated with the Air Quality Index. The reason for this is that when we were developing the AQI in 1999, we held focus groups around the country. And the number one question that people wanted answered is, will I be affected? Will my child with asthma be affected? Will my father with heart disease be affected? To be able to answer that question, we had to develop pollutant-specific health effects and cautionary statements because different pollutants affect different groups. The Air Quality Index is based on the health information supporting the National Ambient Air Quality Standards. This is information that is reviewed regularly and comes from many different types of human health effects studies, including controlled human exposure studies, where volunteers are placed in chambers and exposed to very precise amounts of pollutants, and epidemiological studies, which look at patterns of disease associated with air quality levels, including panel studies in which individuals are fitted out with personal exposure monitors to measure what they are exposed to. In a controlled human exposure study, the dose that an individual is exposed to is the product of the concentration that they're exposed to times their ventilation rate or breathing rate, typically in liters per minute, times the time that they are exposed, which is typically in minutes. And air quality advisories are based on this formula. To reduce the dose that an individual is exposed to, you can reduce the concentration by being active outdoors when air quality is better. Or if that isn't a possibility, take it a little easier when you're active outdoors. Instead of going for a run, go for a jog or go for a walk. If you don't want to reduce your exertion levels, then cut back on the time that you're outdoors. Instead of running for 30 minutes, run for 15. Next, we're going to talk about who must report the air quality index. These reporting requirements come from 40 CFR Part 58.5. Reporting is required in metropolitan statistical areas with populations greater than 350,000. Reporting is required on a daily basis, which is defined as reporting at least 5 days a week. Reports must be provided to the local media, including newspapers, radio, and television. And the report must be made available in at least one place of public access. These can include recorded phone messages that people can call, faxes that are sent out to people who subscribe to it or organizations, and the information can be made available on a website. One new and innovative approach to making AQI reports available is the school flag program. And this is where schools fly a flag that is the color of the air quality index for that day. That way parents dropping their children off at school, teachers taking kids out for recess, and coaches can know what air quality is going to be for that day and modify their activities accordingly. Real-time data reporting and voluntary action programs are also a way to report the air quality index. What must an AQI report contain? Most of this is common sense. Obviously, you would want to include the reporting area that the AQI report is for and the reporting period. Many air quality agencies report not only yesterday's air quality index, but what the AQI is going to be on that given day. Many areas also forecast the air quality index, so it's important to specify the reporting period. Most agencies calculate the air quality index for more than one pollutant. And if you do that, you're required to report the highest AQI value. And you're also required to report the critical pollutant. This is the pollutant with the highest AQI value. So for example, if you calculate the air quality index for ozone and PM, and ozone is the pollutant with the highest AQI value, then ozone is the critical pollutant. Your AQI must also report the category descriptor. And this would be good, moderate, unhealthy for sensitive groups, unhealthy, very unhealthy, or hazardous. You are not required to report the air quality index using colors, but if you do, you are required to report specific colors. This is so that a red in Boston means the same thing as a red in Los Angeles. The technical support document, which you can find on Air Now, has specific formulas for reporting the air quality index using colors in both print and on the screen. And if the air quality index is above 100 for more than one pollutant, you are required to report the sensitive groups for all pollutants that are above 100. There is other information that is useful to include in your AQI report. You may want to include the name and index value for all the pollutants that you have estimated, but especially if those are above 100. You may want to include the health effects and cautionary language that you can find in the technical assistance document. You may want to report the air quality index for sub-areas of your reporting area if you have heterogeneous air quality. A good example of this is the Los Angeles Air Quality Basin. The South Coast Air Quality Management District reports air quality real-time, air quality forecasts for different regions within this air quality basin. You may also want to report the actual pollutant concentrations in parts per million or micrograms per cubic meter, or the causes for unusual AQI values. These could be high values that result from forest fires or meteorological conditions such as inversions. An inversion is a situation where you have warm air aloft, keeping close to the ground cooler air, trapping pollutants and raising pollutant levels close to the ground. You may also want to blend the health effects and cautionary statements if more than one pollutant is above 100. This is to avoid repetitive statements. So if you have several pollutants that are above 100, look at the health effects and cautionary statements and merge them into one statement. When the air quality index is above 100, obviously that's the time to get the word out. It's important to help people protect their health, and it's also a newsworthy event. Appendix G recommends that when the air quality index is above 100, it's critical that you report to all the major news media, especially the media with the largest market coverages for your area. Forecasts are important to the public. This advance notification allows people to take exposure reduction measures to protect their health and also reduce emissions. Focus group testing has shown that bad air days can be teachable moments. People have told us that when air quality is bad, that's when they're willing to look for more information. A tool that can be very useful in getting out the message when air quality is bad is EnviroFlash, and we're going to tell you more about that in just a minute.
Thanks, Susan, for that overview of the Air Quality Index and how it's reported. Now I'll tell you a little bit about the AirNow program, which is a real-time data system providing AQI information to the public. AirNow began back in 1997 as a partnership between local, state, and federal agencies. In 1997, the public had no real way to get to real-time air quality information. The process to get air quality information for your particular area could take months. So we got together with state, local, and federal agencies and decided to do something about that. We created the AirNow system. What AirNow does is we've established a data management center that is operated by a contractor that collects forecasts and real-time data from hundreds of agencies across the U.S. And the neat thing about this is it does that every hour, 24 hours a day, 7 days a week. So the public now has access to information that is just a little over 1 hour old for air quality. The Data Management Center is a central distribution point as well for real-time data and forecasts to the media. So not only are we collecting this data from the state and local agencies that are measuring it, but we're also serving as a central point to distribute this out to media outlets. So we send this data to USA Today, the Weather Channel, and other media outlets, and they appreciate the availability of a national product. So they can get one product from the AirNow system that represents all the air quality data for the entire country. Also for the public, we have the airnow.gov website. That website distributes real-time data, health information, and air quality news to the public. So for the first time, the public has access to actual data about air quality in their neighborhood, health information about the AQI, health effects, and what they can do to avoid exposure to poor air quality. We also use the airnow.gov website for emergency situations. If there's a wildfire, we might do a special story about the wildfire, as well as point people to the latest real-time data about that incident. So now that I've told you about AirNow, we have a presentation we call An Hour in the Life of an AirNow Ozone Molecule. And this really brings the point home about how quickly AirNow is able to process real-time air quality data. So, an hour in the life of an AirNow ozone molecule. The journey begins when the AirNow ozone molecule is measured out in the field. Basically, intake pulls air in, including our AirNow ozone molecule, and that then goes into a data acquisition platform at the monitoring site. Next, that ozone molecule journeys to the state or local air quality agency. That agency is collecting data from all the monitors that that agency is responsible for. So it could be tens or hundreds of monitors. To make this all work from an IT perspective, we have an OBS data file, which is a format we established for all the state and local agencies to deliver their data. So next, the AirNow ozone molecule goes to the Data Management Center, which I mentioned previously. The Data Management Center has a database and some quality control programs where all this data comes in and is automatically quality assured and quality checked to make sure that we're not falsely alerting people on bad air quality. It also has redundant computer servers. The files are processed in mere seconds, and we process at about 30,000 data values each and every day and produce 50 maps for the airnow.gov website every hour. So the last leg of the journey, now that we have this nationwide data product in the Data Management Center, Of course, we want to deliver that to the airnow.gov website for the public to use, but we also deliver it to weather and news providers, such as the Weather Channel and WSPs, or weather service providers. Those companies actually deliver the data to your on-air meteorologists. We also deliver to other media outlets like USA Today, Weather Underground, AccuWeather. And hopefully the public can also get that information from those providers. Media coverage, you can see the air quality data actually does get used on the air because of our efforts to deliver to the different media outlets. So that is an hour in the life of an AirNow ozone molecule. Now that you've heard about the AirNow Real-Time Data Program, you're probably wondering how you can start a forecast program. The AirNow website receives forecasts for nearly 400 cities across the U.S. right now. So there are 400 cities that are being forecast for, and you can also start a forecast system for your city. Also, forecasting programs right now focus primarily on ozone and fine particles, but as the NACs get revised, there may be other pollutants that begin to be forecast for. So the air quality forecasts come into the AirNow website each and every hour along with the real-time data. The forecasts are then distributed to media outlets, the same as the real-time air quality data. So we distribute forecasts to USA Today, the Weather Channel, CNN, and USA Today actually use those forecasts on the back page, the weather page of their newspaper. Forecasts are also used to drive the EnviroFlash system that Susan mentioned, which is our email notification tool that's available to the public. So you may be wondering, how do you start an air quality forecasting program? So if you want to do it, how do you start? Probably the best way is to talk to other agencies in your area that are already doing forecasts. There are a lot of different ways to create a forecast program. There are mathematical methods, statistical methods, and a lot of it depends on the local climatology, the emissions profile of your area, and basically there are a lot of different things that depend on your local area. So you might want to talk to other agencies that are forecasting in your area. You can also talk to anyone on the AirNow team. We can point you in the right direction to talk to forecasters across the nation to get their valuable input. So, if you develop a forecast program and get your meteorology and emissions profile straightened out and start actually issuing a forecast, what do you do with that forecast? Well, you submit it to the AirNow system. That gets your forecast out to the public immediately on the airnow.gov website. It also gets your forecast in the hands of media outlets like USA Today or the Weather Channel. And it immediately sets you up to be able to use the EnviroFlash system, which would allow your public citizens to sign up to get the forecast via email. And that leads us naturally into a discussion on the EnviroFlash system, which I've mentioned several times. The EnviroFlash system is an email system that allows users to sign up to receive notification of air quality forecasts and action days for the area of their choice at the AQI level of their choice. So what this means is a private citizen can log onto the EnviroFlash system. They can use a zip code to find their nearest city that has a forecast, and then they can subscribe to get that forecast at any AQI level. So they may want to see the forecast anytime it's good or above, which would essentially result in them getting the forecast every day, or they may only be interested in the moderate level or the unhealthy for sensitive groups level. They can sign up and pick the level of their interest. Also, you're not limited to signing up to the area you live in. If you're taking a trip cross country, you're going to spend a week in Los Angeles, you might want to sign up for the EnviroFlash forecast out there. And best of all, the system is completely free. All the agency has to do is submit a forecast, and the AirNow team will help you set up your EnviroFlash system. People can subscribe to it, and you really don't have to spend any money. EnviroFlash also allows customization to make sure your agency logo appears on the emails. As part of the setup process, you get to go in and add your logo, you get to customize the look and the text of the email. So if you're curious how the system works, you can log on to enviroflash.info and actually check it out. Now, there are other ways to communicate the AQI as well. Submission to AirNow can help satisfy the AQI reporting requirement, because that is one way to get the AQI out to the public. EnviroFlash allows the public to get email forecasts at whatever AQI levels they choose, so that citizens will be able to get the latest AQI level in their email.
Thanks, Phil, for telling us how to get the AQI out to the public. But we know that there are important target audiences that you will want to reach. One of the most important groups are healthcare providers. The Centers for Disease Control and Prevention, in their Behavioral Risk Factor Surveillance Survey, asked questions about the Air Quality Index. They asked people about their responses. People with poorer health or people who lived in places with poorer air quality said that they were more likely to follow Air Quality Index advisories. But people who were told by their healthcare providers about the air quality index were the most likely to follow air quality index advisors. So we know that healthcare providers are an important target audience to reach. And we have products on the AirNow website that you can provide to healthcare providers to help them educate their clients. These include a medical poster which describes the cardiovascular and respiratory health effects of air pollution. This poster is available in English and Spanish. We have an ozone web course for healthcare providers that describes the effects of ozone on the general public and sensitive groups. It has great graphics and clinical scenarios. We've tested this web course in focus group testing with healthcare providers, and they have routinely liked it. We are currently updating it to reflect new information from the most recent review of the National Ambient Air Quality Standards. We also have downloadable fact sheets. The one you're looking at now is a fact sheet for people with heart disease that we developed with the American Heart Association and the American College of Cardiology. It's available for doctors to give to their patients, and the nice thing is they don't have to order these materials from us. They can just download them and print them in their office. Another very important target audience to reach are teachers and students. I think we all know that. The AirNow website has lesson plans for teachers, from teachers who teach the very youngest students to teachers who teach high school age students. We also have learning modules for students. The learning module for grades K through first grade features a butterfly and has voiceover text so that students don't have to be able to read the website. The learning module for grades 2 through 5 features chameleons, and the learning module for grades 6 through 10th features Smog City, an interactive game that allows the student to change various aspects to see what effects that has on pollution. In other words, they can increase or decrease the number of cars, they can change the weather, increase or decrease the population, and they can see the effects that this has on air pollution levels. All of these units have interesting and fun games that will teach students about air quality.
And also, Susan, another important target audience is weathercasters. I mentioned in my previous talk that AirNow provides a coordinated national product to deliver to the weather service providers. Those weather service providers then supply that data to your actual TV on-air meteorologists. And we all know that those TV meteorologists like to go out to schools and talk to children and like to do funny things during the weathercasts. So we provide them reference materials for use on the weathercasts. And they can also use those when they go out to schools to talk to students. So we've created an educational toolkit for the weathercasters. They can use these when they're making educational presentations to schools and civics groups, and we even were able to get these products endorsed by the American Meteorological Society and the National Weather Association, which lends credence to their quality for the weathercasters. Another important aspect of the Air Quality Index and the AirNow program is the National Air Quality Conferences, or NAQC. We have this conference every year in the spring, and it's actually 3 different conferences combined into one. We have an air quality forecasting and mapping track where we discussed air quality forecasting, different mapping methods, satellite data, and things like that. We also have communicating air quality. That's about how you get the message out on air quality and air quality conditions. And we also have an ambient air monitoring track to discuss monitoring technologies. This conference is held in the spring of each year, and it's really a great way to keep up to date on technology, learn what other agencies are doing, and network with your peers. Especially for new non-attainment areas, this would be a great conference to come to because you'll get to harvest the experience over a decade or so of all the other agencies that have been doing the things that you'll now be faced with.
Another great reason to come to the National Air Quality Conference is to learn about voluntary programs. The way that voluntary programs typically work, they often work through a public-private partnership where air quality agencies partner with local businesses to get the word out about air quality. Typically these use forecasts. The forecasts help people reduce their exposure to protect their health and also reduce emissions. We're going to talk about 2 exceptional voluntary programs here, but there are many, many exceptional programs around the country, including places like the state of Michigan, the state of North Carolina, the Washington, D.C., Baltimore metro area, the Atlanta metro area, and many more. So when you come to the National Air Quality Conference, you can get a lot of ideas from these programs, and they're really very, very innovative. We're going to talk specifically about two outstanding programs. These are the Spare the Air program from Sacramento Air Quality Management District and the Healthy Air Living program from the San Joaquin Valley Air Quality Management District. The Spare the Air program has been in operation since 1995. It was one of the early promoters of the Air Quality Index when we promulgated it in 1999. It uses year-round public education to inform the public about air quality issues, the sources of poor air quality, the times of poor air quality, and then it informs people when air quality is unhealthy. There is an episodic ozone reduction element that occurs during the summer ozone season. When ozone levels are high, people are asked to reduce their exposure and also reduce their emissions. It achieves voluntary emission reductions by encouraging people to reduce vehicle trips on high ozone days. The components of this system are a great website, sparetheair.com, daily regional air quality forecasting. This is one of the first areas in the country to have multi-day air quality forecasting, recognizing that people can't change their activities just with one day's advance notice. They have online real-time air quality reporting and mapping. They have the production and airing of television and radio commercials. You're going to see one of those television commercials in just a minute. They have their Air Alert email notification system. They have very creative brochures and other printed materials that are distributed to the public, businesses, and other members of the community that are available in both English and Spanish. There are community events that include elementary school assemblies throughout the region, and there is an annual awareness survey to determine the program's effectiveness. Let's see one of their great television commercials.
This is a Spare the Air advisory. Today's air quality is forecast to be unhealthy. Here's what you need to do. Don't drive or reduce your driving during this period of bad air so pollution doesn't get worse. To protect your health, avoid outdoor exercise during the afternoon when pollution levels are at their highest. For current conditions or to sign up for an Air Alert email, visit sparetheair.com. This advisory is brought to you by the Sacramento Metropolitan Air Quality Management District and the air districts of the Sacramento region.
We'd also like to tell you about the San Joaquin Valley's Healthy Air Living program. Healthy Air Living is a comprehensive outreach initiative that's built on the strategy that behavior change needs to be daily action. It's designed to preemptively reduce unhealthy air quality days and improve public health and quality of life through strategies that actually clean up the air. Healthy Air Living encourages people and businesses to make lasting changes to positively affect air quality. And there's something for every segment of the community to become involved in and ways to do it. Unhealthy air quality days are still communicated to the public through the media. And Healthy Air Living has created a toolbox that every resident and business can use to create a cleaner and healthier environment. That offers alternatives for day-to-day needs such as transportation and a way to promote green contracting, as well as incentives and partnerships with businesses, faith-based organizations, health organizations, and municipalities. The Healthy Air Living website is at www.healthyairliving.com. We encourage you to check that out. And now we'd like to show you a video from the Healthy Air Living program.
What if we told you that you have the power to change the valley?
And all it takes is for you to make one change.
You could be the reason the air is cleaner.
The reason people breathe easier.
The reason the valley is a healthier place to live.
Make air quality a priority in your everyday life. Visit healthyairliving.com
And learn how easy it is to make one change.
Visit healthyairliving.com. A message from the Valley Air District.
Thank you for joining us today, and if you have further questions or would like to check out some other aspects of these programs, please check the following resources.